Firstly, welcome to this webinar, which is launching an ENN and UNICEF report on preconception nutrition. Thank you very much to everybody who's just joining us. And we do recognise that it's a difficult time for the sector. A lot of us are facing uncertainty at the moment, so it's especially appreciated that you're taking the time to join these technical discussions. We really do appreciate that. My name is Natasha Lelyveld. I work at ENN and I lead the portfolio on adolescent and women's nutrition. So I'm just going to say a few words and then I'm going to hand over to our other speakers. So ENN has been championing the need for more of a focus on women's nutrition since our very first report on this topic in 2012, which was actually written by one of our speakers here today, by Emily Mates, who is now at UNICEF. And because of Emily's passion for this important topic of adolescent and women's nutrition, ENN continues to identify evidence gaps, try to fill them, and try to improve funding, policy, and practice for this topic. So in 2021, we published another report summarising evidence, policy, and practice related to all areas of women's nutrition. And in researching this, we found that there was definitely a gap for humanitarian context. So that led on to another report in 2022 that focused on women's nutrition in humanitarian contexts. And there was also an accompanying case study from Madagascar. Over recent years, there has been growing global momentum on the progressing women's and adolescent nutrition. I think partners like UNICEF, as well as Healthy Mothers, Healthy Babies Consortium and Micronutrient Forum, have all done really great work in advancing this space. UNICEF's Undernourished and Overlooked report in 2023 really pushed home that progress on women's nutrition is too slow and even under threat from going backwards. So there's definitely been progress, although it can seem that political will in this space is sometimes not where it needs to be. It's a real shame that we've seen no countries reach their SDG target on anemia reduction for women and girls. However, there's lots of us still working in this space, doing what we can, and some of the key progress over the last few years includes the formal recognition of a MUAC cutoff for malnourished pregnant women, the large push and scale up of MMS for pregnant women worldwide, which ENN supported with a review in 2024, and also the excellent programming guidance from UNICEF in 2024 about protecting the nutrition of women and girls. So as this topic of women nutrition continues to evolve, both ENN and UNICEF really strive to stay ahead of the evidence and the gaps and the programming needs. So that's what led us to this current report on preconception nutrition. Preconception is biologically a really important period for women and children's health. However, it's also a really complicated period to define and to target for nutritional support. I think the great report that we're launching today, which was written by Heather Oley, Phil James, Susan Fuller, and Emily Mates, really walks that delicate line between recognizing the importance of preconception period, but also recognizing that many women do not know if and when they will become pregnant, and that women's nutrition is also a human right of its own, whether or not they become pregnant in the future. So with those few words, I can't wait to hear more about the report from the authors themselves, and hopefully it's useful for your own work. Just a small housekeeping point: if you do have questions for the speakers, please put them in the chat and we'll come to them later. So over to Emily at UNICEF.
Thanks, Natasha. Excuse me for that very nice introduction. Yes, welcome to everybody. We're delighted to be launching this report today. We will have an hour together, so it's not a huge amount of time, but hopefully enough time to give you a flavour of what's in the report. And also, we're very honoured to be hearing from Sri Lanka Ministry of Health about what they've been doing. So we'll come to that in a moment. But we're going to start off with giving Heather Oley, the lead author of the report, a senior nutritionist at ENN, is going to give us a brief overview of what the report contains. So over to you, Heather.
Thanks, Emily. Hi, everyone. I'm Heather Oley from ENN. I co-authored this report with my colleagues Phil James, Susan Fuller and Emily Mates from UNICEF. I'd really like to acknowledge the funding we received from UNICEF and the Department of Foreign Affairs and Trade of Ireland, which has made this work possible. Also to note that a French language version of the report will become available soon. Next slide, please. This report is grounded in the principle that all women and adolescent girls have the right to nutrition. We've defined the preconception period broadly, rather than specifying a certain number of weeks or months before pregnancy. This definition includes all non-pregnant women and adolescent girls of reproductive age, regardless of whether they become mothers. We also recognise the vital importance of good nutrition in early pregnancy. We know that many pregnancies are unplanned and many pregnancies are not confirmed until late in the first trimester. So that's why we need to support women before pregnancy. This report provides a resource for governments, practitioners and policymakers working to improve the nutrition of women and adolescent girls, both for their own health and well-being and to prepare those who subsequently become pregnant. Next slide, please. We've produced a short video to help explain what this report is about and who it's for. So we'll play the video now.
The Emergency Nutrition Network, in partnership with UNICEF, has published a new report on preconception nutrition. But what does that really mean? Preconception means the time before pregnancy, but this time isn't always clear. Many women don't know when they'll become pregnant, and many pregnancies are unplanned. So, the preconception period could be weeks, months, or even years. We already know that good nutrition early in pregnancy is crucial. It supports healthy development for the baby and long-term health outcomes. But here's the challenge. Many women do not have regular access to health care. Pregnancy is often confirmed late after a vital window for early nutrition has passed. That's why we must start before pregnancy. We need to improve women's nutrition earlier and more consistently. And we must think bigger. Good nutrition isn't just about pregnancy. Every woman and every adolescent girl has the right to good nutrition at every stage of life. This report looks at all non-pregnant women and adolescent girls, regardless of their age, marital status, or plans for pregnancy. It focuses on the burden of undernutrition in low and middle-income countries, while also recognizing the rise of overweight and obesity. We highlight the latest evidence and the World Health Organization guidance on key interventions like nutrition supplements, health screening, food fortification, and promoting healthy diets. We also identify gaps in policy, research, and services, and we recommend practical steps for moving forward. If you work to improve the nutrition of women, this report is for you.
Thanks. Next slide, please. Thank you. So what did we do? We reviewed the available evidence on preconception nutrition interventions, focusing on nutrition-specific interventions and those that are relevant to undernourished contexts, particularly in low and middle income countries where underweight and micronutrient deficiencies are prevalent. We also reviewed WHO guidelines and recommendations that apply to women and adolescent girls during the preconception period. For each type of intervention, we identify gaps in research, policy, and practice, and make recommendations on next steps to further progress. Next slide, please. So the first section of our findings is about preconception supplementation. This includes iron and folic acid, MMS, iodine, and SQLNS. For each type of supplementation, we present an overview of the existing evidence, WHO guidelines, and then key gaps and recommendations. Next slide, please. For example, there are currently 3 WHO recommendations relating to iron, folic acid, or combined IFA supplementation that apply to women and adolescent girls. This we feel is potentially confusing and may lead to inconsistent implementation. 2 of these recommendations are specifically for settings with high prevalence of anemia among non-pregnant women and adolescent girls. But we know that many countries do not have accurate population level anemia data. Furthermore, the current folic acid guideline only targets women who are trying to conceive, but we know that approximately half of all pregnancies are unplanned. Therefore, we recommend that WHO considers updating and combining the current guidelines into a single set of guidelines on iron and folic acid supplementation for all non-pregnant women and adolescent girls, reflecting the latest evidence on optimal dose, duration, and schedule of supplementation. Next slide, please. In this section, we highlight the lack of evidence and guidelines relating to screening and referral during the preconception period, focusing on anemia and underweight. We highlight gaps and recommendations for improving the identification and management of undernutrition in non-pregnant women and adolescent girls. Given the lack of progress in reducing global anemia prevalence, we recommend that WHO guidelines should reflect current knowledge on best practice so that anemia reduction efforts may be implemented where resources allow. This should include a recommendation for routine anemia screening and referral in non-pregnant women and adolescent girls, even though this may not be feasible to implement across all settings. For underweight, global consensus is needed on anthropometric indicators and cutoffs for non-pregnant women and adolescent girls to improve surveillance and referral mechanisms. Next slide, please. Next, we look at population-level interventions that may influence the diets and nutritional status of women and adolescent girls during the preconception period. This includes promoting healthy diets through nutrition education and counselling, and fortification of staple foods with essential vitamins and minerals. In general, there's a lack of disaggregated data for non-pregnant women and adolescent girls, and the effects of population-level interventions on this subgroup are unknown. We highlight gaps and recommendations for scaling up programming and for improving data collection and monitoring. Next slide, please. In the final section of our report, we showcase examples of how preconception nutrition has been integrated into policy, programming, and practical guidance, from national preconception care guidelines in Ethiopia to a nutrition project for female garment sector workers in Bangladesh. And our next speaker will say more about how this has been achieved in Sri Lanka. So I'm really looking forward to hearing from them. That's all for me. Thank you very much. And back to you, Emily.
Thank you so much, Heather. That was a great overview. Okay, so we haven't got away with no technical issues. The chat box, unfortunately, is disabled and we can't switch it on once the webinar is running. So if you have any questions or comments or anything you'd like to say, could you please put it in the Q&A box? That would be great. Thank you. So now, absolutely delighted to introduce our next speaker, is Dr. Chandima Siratunga, and he's the Director of the Family Health Bureau of the Ministry of Health in Sri Lanka. Dr. Chandima is a public health specialist and has been working in this field for 30 years as a medical professional. And as part of this, he's been at the forefront of maternal, newborn, child, adolescent, and youth health and nutrition programs, which include preconception nutrition. So, very warm welcome to Dr. Chandima. Over to you. And I think you're going to share your own slides. Yeah, go for it.
Today to you. Thank you very much for you to give this for you giving this opportunity for me as a Sri Lankan to share our experience, Sri Lankan's experience in preconception nutrition. I think the previously also this was highlighted. Why preconception nutrition matters, that preconception period is crucial for reducing the maternal anemia, the underweight and overweight, and also optimizing fetal growth and development, and also breaking the intergenerational cycle of malnutrition. In Sri Lanka, the country, when you consider the country context, our maternal mortality ratio is 25 per 100,000 live births. The female literacy rate is 91%. The antenatal care coverage is more than 95%. And also percentage of pregnant mothers registered, out of registered births reported 97%. Also, the percentage of pregnant mothers receive folic acid 3 months before conception, it's 69% nearly. And also prevalence of maternal anemia is 22%. And percentage of antenatal women with BMI less than 18.5 at booking visit is 14.7%. And also the percentage of antenatal women with BMI more than 25 at booking visit is also 31.8%. So when you consider our national policies and strategic frameworks related to this issue, our national nutrition policy, Sri Lanka from 2021 to 2030 says the provision of pre-pregnancy care for the couple before planning their first child, or to plan subsequent pregnancies and to enter pregnancy with optimum nutrition in a supportive environment. Also, our national policy on maternal and child health, which was done in 2012, says they promote health of women and their partners to enter pregnancy in optimal health and to maintain a thoughtful life course. Our national strategic plan for maternal and newborn health, that is from 2020 to 25, we have the first 3 objectives focuses on preconception care. It has to increase the proportion of newly married couples receiving the preconception care package to 90% by 2025, and also to maintain the rubella immunization coverage at the time of pregnancy at 99%, and to increase the proportion of pregnant women who have received preconception folic acid supplement to 90% by 2025. So I would say that this is a total package, not only targeted on nutrition, but it's a total package we are targeting. So Sri Lanka's free health policy ensures all citizens have access to government-provided healthcare, including free healthcare, and preconception care delivers as a national program through the well-established field healthcare system of Sri Lanka. So it's the medical officers of health and the public health midwives and the team delivers the services at grassroots level. The preconception care is delivered as a care package targeting newly married couples, including legally and customarily married and living together heterosexual couples. So I should say that even in our school health program, this iron folate supplementation program is but this special preconception care package we introduced for these newly married couples, legally or customary married and living together. So this coordinate with marriage registrars to receive information on newly wedded couples, and information and data managed through our ERHMIS system, the Ministry of Health. The estimated target population is 0.8% of the total population, and percentage of newly married couples registered out of the estimate, it's nearly 55% according to the 2024 data. And the preconception care services package received is 61.5 of all the registered couples. That was the our current coverage actually. And this package objectives to improve the knowledge and awareness of couple on reproductive health and to minimize unhealthy lifestyles such as alcohol, tobacco use, gender-based violence, etc. in order to create a conducive behavioral change in the couple. To improve the health and nutrition status of women, maximally to ensure healthy pregnancy before they become pregnant. So that is the nutritional related objective which we have in our PCC program. And the next one is to identify and correct or minimize the health problems of husband and wife before they achieve parenthood. And then to minimize maternal and infant mortality by reducing complications during pregnancy and delivery. So our preconception care package for newly married couples in Sri Lanka consists of assessment of health, the nutrition, behavior, and environmental risk factors of the couple. And also it includes the health education and promotion. And also there's a care provision and follow-up also. So best practices in relation to PCC nutrition. All women planning to be pregnant guided to take folic acid daily at least 3 months before the conception. And the next one is all women guided to achieve and maintain the optimum BMI for pregnancy. So it's in the preconception area, preconception stage that we are doing all these things. And promoting a diet composed of fruits, vegetables, whole grains, and lean meats and dairy products. And all women are screened for anemia and corrected before pregnancy. So these are the best practices in a relation to nutrition in pre-pregnancy care package. So supporting tools and guidance for package for newly married couples. It should include the service package for newly married couples. It's a general circular. And there's an invitation card to be handed over by the marriage registrar at the time of marriage registration. And also there's a preconception screening tool to be filled by the couple and to be assessed by the preconception care providers. And also there's a BMI calculator to be used at the physical assessment. And there is this DVD produced that's called Yuga Diviyata Atpalakin Sinhalese. And and also there's a Tamil version also for education sessions. And the DVD to be used at the sexual education session. And our best wishes for your home and so on to look at that. There's booklet to be referred by the couple, and these all are IC materials are there. And so I will show some of the IEC material which you are using all languages, which we all the for all the Sri Lankan nationality. So topics discussed at health education sessions are usually these are related to sexuality and sexual relationship, sexually transmitted diseases, well-planned family, disease preconception, nutrition, and good living and mutual understanding, family-free violence, male participation and parenthood and before conception. So these are the basically the topics to be discussed. And these are the IEC material used, and I will show you 2 videos which were produced in our main languages, English and Tamil, for your consideration.
ඔබත් ළඟදී විවාහ වුණාද? සුවෙන් සතුටෙන් පිරි දුක දෙවියකට නව දිවි සුවසත්කාර සේවය නවක විවාහපත් ඔබ දෙපළ වෙනුවෙන්මයි. නොපමාව ඔබ ප්‍රදේශයේ පවුල් සෞඛ්‍ය සේවා නිලධාරිනිය හමුවන්න. සර්ව මංගල මාංගල්‍යේ ශිවේ සර්වාර්ථ සාධිකේ.
திருமண வாழ்த்துக்கள்.
Sorry that video didn't play well for some reason. Anyway, the challenges and way forward of our program. There's actually the coverage, even though we have the target for 90%, we have the low coverage of the target population and challenge of limited, mainly involved in preconception health. And so we have the regular public awareness campaigns. And we have we are targeting to introduce an interpregnancy care package at the development stage. And so the resource gaps of facilitate basic investigations from the state health system is also there at the preconception stage. And also research gaps to provide micronutrient supplements to the state health system at the preconceptions, because if we have the program during the pregnancy, these all are there, but the pre-pregnancy, sometimes in the state service that we are in the limitation for provision of these things. So the discussions are going to facilitate basic investigations and micronutrient supplements from the state health system at the moment. So the conclusion is the preconception nutrition is a foundational investment. So Sri Lanka's model centered on community-based care, policy integration, and frontline engagement offers valuable lessons, but also highlights the need for continuous adaptation. So thank you very much for your attention.
Thank you so much, Dr. Chandima. That was a really fascinating overview of what's going on in Sri Lanka. And I'm sorry your video didn't work, but we did get to hear some nice music for a bit. So thank you for that. So now I'm going to hand over to Zavai Murira, who is UNICEF's regional nutrition advisor in the ROSA region, so South Asia region. And the regional office have been working very hard with lots of partners to develop a series of articles. So Zavai is going to tell us all about that. Over to you, Zavai. Thanks.
Thank you so much, Emily, for the kind introduction. Really pleased to be part of this webinar to speak about the issues which worry us a lot in South Asia, which is resolving the malnutrition crisis. And women's nutrition is central to resolving this crisis. And big congratulations to you all on the launch of this report, but also great to hear from Dr. Chandama on the ongoing efforts in Sri Lanka. So what I'm going to share in the next couple of minutes reflects a collective effort. And I would like to thank all the partners, the country colleagues in South Asia, and also my colleagues in ROSA, Vani Sethi, and others, who have all played a key role in advancing what I'm going to share in the next couple of minutes. Next slide. So the need is clear. I think it is highlighted by the previous speakers. Progress in reducing adolescent girls and women's nutrition is too slow. And in South Asia, 40% of low birth weights babies are in this region. So, which is a very big number. And also women are entering pregnancy with multiple risks. While evidence shows that preconception nutrition interventions are critical, women's nutrition in preconception period is being left behind. And there are several knowledge gaps which are preventing integration of preconception nutrition interventions at scale. Next slide. So while there's a lot of momentum, especially around nutritional support and care during the antenatal care period, the same attention is not there around preconception nutrition. So in 2023, UNICEF Regional Office for South Asia convened a regional conference to galvanize action within the region to scale up equitable nutritional care and support for girls and women. And one of the key recommendations that came from this was the need to bridge knowledge gaps for strengthening delivery of preconception nutrition services in South Asia, in the national policies, and also within programs. And in the next couple of slides, I'm going to share what we've actually done to advance this agenda in South Asia, but also galvanize the momentum. Next slide. So the first thing has been to address these knowledge gaps, which are precluding progress, which meant the need to synthesize available evidence in the region. And then secondly, also trigger some expert country consultations on the need for action and the cost of inaction. And then third, build an alliance, a regional alliance, to help drive this agenda on preconception nutrition, and also the partnerships on various strands of the work we've undertaken in the region. And then fourth, also demonstrate how to deliver these key interventions within preconception care to inform practice, but also guidance in the region. And to do so, we've also supported efforts in the region to develop some tools and algorithms, guidance, which can help countries as they integrate preconception care within their programs, but also demonstrate how to deliver it at scale. And in the next few slides, I'll go through each one of these to just give some key highlights of what we've done. Next slide. So to address the knowledge gaps which are standing in the way of improving preconception nutrition, we've actually done some regional reviews which we've published in the Lancet, and also some of the reports you can find on the UNICEF website. And I think the findings echo a lot of what has already been shared in terms coming out of the global review. Next slide. And so with partners, we sought to sort of answer a few key questions which we felt were important to inform both policy but also practice. And we've summarized all these in the Lancet Regional Health Southeast Asia May 2025 issue, where there are 4 papers which summarize the key findings, but also offer some suggestions how we can address some of the gaps, but also strengthen delivery. So the first paper looked into the prevalence, determinants, and associations with pregnancy and birth outcomes. And then the second paper looked at what works to have impact both on women's nutrition during pregnancy, but also the birth outcomes. And then third, we also looked at policies and programs to improve preconception nutrition. And lastly, summarize the key research gaps and perhaps priorities for further research, so that policies, programs can be evidence informed. And the findings from these regional reviews, the work we've done has informed recommendations, which we've summarized in a technical brief for improving nutrition for women before, between, and during pregnancy in South Asia. And now I'll just go through some of the key highlights. Next slide. So in terms of state of play of preconception nutrition in South Asia, I think all forms of malnutrition highly prevalent within the preconception period. And there is coexistence undernutrition and also overnutrition. And there are also clear inequities. Vulnerable and underserved women are the most affected. And also there are large variations and gaps in data on preconception nutrition and links with birth outcomes. So in terms of elucidating very clear pathways, the link between the interventions within preconception nutrition and the birth outcomes, there are still gaps within the region. And it's a key research priority which is being looked into. And then the second paper, next slide. The second paper looked at what works. And while there's growing evidence globally, in South Asia, from this review, we found is quite limited. However, there are some promising interventions which are having impacts on low birth weight and small for gestational babies in South Asia. And a key sort of finding is the centrality of multi-sectoral interventions which combine health, nutrition, and also psychosocial support and address some of the WASH components. And then secondly, starting these interventions greater than 90 days before conception brings greater impacts. But also women need access to nutritious foods. So micronutrient interventions alone are not enough. And as I highlighted, when we look at the malnutrition burden within the region, it's the most marginalized, the most vulnerable women who actually require a holistic package of support. Next slide. In terms of policies and programs, I think when we look across the WHO 2013, the UNICEF global guidelines, there are around 22 interventions, which you can summarize across 5 buckets. When we reviewed across all 8 countries in South Asia, they all have policies which are supportive of preconception nutrition interventions. However, no country has programs that deliver the full package of recommended interventions. But also countries face barriers that limit the quality of delivery. And leadership governance, budget financing gaps, service delivery, they are all different bottlenecks within this. Next slide. And I think Sri Lanka is already shared. I won't go into that, but it's an exemplar within the region where the government has been quite intentional in integrating preconception care into existing systems. And I think it's a country which can offer lessons to many other countries. And I think it's the leadership which is critical in so doing, but also thinking outside the box in terms of looking at the different delivery platforms beyond the health system, which are key for the early identification, but also providing support to women before conception. And also in India, a multi-sectoral program has also been very effective in leveraging women's self-help groups in reaching out to the newlywed women. And I would emphasize that sort of the early identification is quite key. And this is where the role of different platforms becomes quite crucial if we are going to make the difference. And it needs to go beyond the health system itself. Next slide. And secondly, as I mentioned, the other sort of key area has been sort of bringing key experts in the region together and rallying them on the need to action. And in 2024, together with the UNICEF India country office, we had a regional convening which brought together different experts to review the evidence base, but also look at what could be done. And there were some good recommendations which came out of that, which actually fed into the regional brief that we developed and the tools which are now accessible to countries in the region as they try to roll out different demonstration programs to improve preconception nutrition. And then next slide, the third area has been sort of building this preconception nutrition collective and alliance, which has brought together different actors from academia, research, policy groups, ourselves, and representation from some of the government stakeholders, basically looking critically at the evidence base, but also supporting countries in their journeys of scaling up these interventions. And this has been something which has been crucial because we've been able to sort of harness the collective expertise and, both global and also from South Asia, enabling sort of transfer of also global knowledge to countries within the region. And this continues to be a key platform as we move forward in further driving this agenda in South Asia region. And then the last part, which I want to speak to next slide, is sort of the work we've done in sort of offering the technical guidance to countries going forward. So understanding the policy program landscape, understanding the sort of evidence base around preconception nutrition is important, but it's not enough. We need to offer countries the right guidance and tools. And to do so, we came up with this technical brief, which includes a framework to guide program managers, countries in taking forward the preconception nutrition agenda. And you can find it on the UNICEF Rosa website. We'll share the link also with you. And what the framework does is sort of try to guide the screening, the actions which are needed, and the monitoring needed to ensure these interventions are being delivered, starting with the assessment of nutritional risks, but also providing women with a package of nutrition interventions, including counseling support, and based on classification of risk, offering risk stratified support. And I think that's something which is quite key, having the algorithm which guides with the classification of that risk so that some tailored support can be provided to women based on the risk levels. And then lastly, sort of maybe I'll end with a call to action, not only to speak to South Asia, but I think it extends beyond South Asia. Next slide, please. So while there are still gaps, which I think the global report has also highlighted in the evidence base, I think there's a lot that we can do just based on best practices, but also what we can demonstrate through demonstration programs, learning by doing. And our key call to all stakeholders is to help with clearly defining the preconception period and the target population. That will help a lot in codifying this into national guidance. And then secondly, creating the right screening tools that can help with identification of risks and providing this risk stratified care, which is quite important. And then third, investing in evaluation efforts on the effectiveness of various preconception interventions on women's outcomes, including in humanitarian settings. And then fourth, integration of interventions and indicators into existing systems, health system and beyond, to reach more women and track progress. And then fifth, leveraging various innovative platforms. As I underscored, we need to think beyond health system. Also, what could be other platforms, which could include marriage registration systems, so that we have greater reach on women who may be missed by other traditional platforms. So I'll end there, but happy to answer any questions. But also, as I said, we'll share links where you can access all this knowledge that we produce in South Asia and also some of these tools. Thank you.
Thank you so much, Savai. That was fascinating. A really good overview of all the work that's gone on and the things that you've discovered. There are a couple of questions specifically for you in the question and answer box. So if you have time, you can maybe answer those now before we hand back to you. So next is Philip James. I'm going to hand over to Phil from ENN. Phil's going to just run through the sort of a background technical paper that has gone alongside the main report, because preconception is a little bit of a complex topic with lots of biological processes that can be hard to wrap your head around sometimes. So Phil's done a lovely job of trying to demystify that and make it more accessible. So over to you, Phil.
Thank you, Emily, and it's a pleasure to be with you all. We're so excited to see these reports launched today. Next slide, please. So, as Emily mentioned, this is a companion piece to our main report that you heard Heather describe. It's essentially a standalone technical annex and provides more detail on, to be honest, what can be quite dense literature on the biological pathways, the mechanisms that are involved in preconception nutrition. So we wrote this with an audience in mind of people who are more interested in some of the detail. We don't think it's critical for everyone involved in programming for women and girls nutrition to be experts on all the biological processes, but many of UNICEF's and ENN's partners expressed to us how useful they would find a primer for some of these concepts. So we really do hope that will be helpful. Next, please. So these bullet points on the slide just capture the main sections of our report, and I'll go through some of them in a little bit more detail. But in summary, we review biological processes, developmental origins of health and disease and its associated literature base, an overview of pathways, mechanisms, and a really short conclusion. It's not a very long report, I promise. Next, please. So here's just a flavour of what's inside our report. We start with defining the preconception period. So whereas in our main report, we took a more pragmatic definition, here we look at a more biological definition, focusing on distinct biological stages or processes that occur in the weeks and months prior to conception. Next, please. So then we go on to defining the developmental origins of health and disease. Many of you know the phrase DOHAD. Also phrases, what happens in the womb lasts a lifetime, or you are what your mother ate. Well, we review the huge body of evidence that now underpins the notion that environmental exposures experienced very early on in life, even in utero, can have lasting impacts throughout the life course. So these exposures can range from maternal stress, pollution, physical activity, but we focus much more on nutrition status of mothers at the time of conception and early pregnancy. So we draw on evidence from famine studies, from studies of differing seasonal exposures, and a case study from the Gambia to illustrate some of these concepts. Next, please. Then we've got a section that tries to unpack some of the mechanisms that may underpin the association between a mother's nutritional status at conception and then later health implications in the developing baby that may well last his or her lifetime. So, for example, we describe 1-carbon metabolism, which is a complex set of many interlinked metabolic pathways. And this can influence literally hundreds of reactions, but we focus on one particular reaction that's integral to a key epigenetic mechanism called DNA methylation. So we start by explaining all the different places that nutrition can influence 1-carbon metabolism. And then we give a bit more of a primer on what do we mean by epigenetics. Very briefly, it describes modifications to DNA that do not change the underlying nucleotide sequence, but they do influence whether genes can be switched on or off. Next, please. So it's quite a complex set of ideas. So we illustrate these concepts very briefly in the report using a very famous animal experiment called the agouti mouse experiment. It's a really powerful illustration of how maternal nutrition very early on in development can strongly influence infant outcomes. So in the interest of time, we want to leave time for questions. I won't go into the details of this experiment, but you can thankfully read it online now. So please do take a look. Next, please. So in conclusion, we really do hope that this report will be helpful for those who want a more accessible introduction to some of the biological processes that are at work in their preconception phase. We think that it's helpful to provide this lens because it really reinforces what we already know, that it is critical, of course, to invest in women's and girls' nutrition throughout their life course, whether they become pregnant or not. And ultimately, we hope that this further strengthens the case for preventative nutrition programming. I will leave it here for now, just to say thanks very much. Happy reading. Back to you, Emily.
Thank you so much, Phil. That was a lovely overview of some very complex concepts. But yes, I do encourage you to read it. I learned a lot while reading it myself. Thank you. So we're coming towards the end. We've managed to keep on time, which is fantastic. And there have been quite a few questions coming in on the Q&A box. We do have a couple for you, Dr. Chandima, if that is possible. Would you like one at a time, or shall I ask you both questions and then you can answer them both?
Yes, you can ask. Yes,
okay, great. So the first one is, does Sri Lanka have perinatal outcome data, for example, low birth weight or small for gestational age, and the coverage of, because the coverage of antenatal care IFA seems to be quite high. So that's the first question. And then the second one is, I think this is a very interesting question. How do you navigate the intersection between the different health departments and the departments for women falling through gaps? So a good coordination question. Over to you.
Actually, we have outcome data. We have not. We have all the data, but still, with the preconception, whether the attended or not, like the connection or the that kind of thing, we have not analyzed yet. But we have prenatal data. That surveillance system is there. So that's it. I don't know what you mean.
Yes, no, that's great. You've got the data in the surveillance system.
But we have not, analyzed with whether our program with yeah.
Thank you. And the second question about how do you navigate the intersection between different health departments and prevent women and adolescent girls falling through the gaps? So a question on coordination across the health different departments.
Within the health department.
Mm-hmm.
So no, we have this awareness, the campaign we have this with the other we have this awareness campaign and this marriage registrars and all these are there, but within the health department, as I said earlier, it was the preconception for the clinics. We do this through our medical officer of health system. So that is the practice that the medical officer of health and the grassroots worker is a public health midwife, and she invite these people to come to our preconception care clinics, and so that is the way that we do this. Yes.
Okay, thank you so much. Thank you. Okay, so there is a question for Zavai, if that's okay. I think an interesting one is, somebody's asked, is there any cost benefit work being done by the UNICEF South Asia team?
Unfortunately, no, we've not done any cost benefit analysis. The work that we've done is more on children, because countries in South Asia are very much interested in sort of the human capital angle, but also on the competitiveness in the knowledge economy. So I think that can also be extended to sort of looking at the cost, the benefits of these investments around preconception nutrition in improving, especially the birth outcomes, which still remains a knowledge gap, I must say. From the review that we did, very few studies have actually shown those kind of impacts. So our call to researchers has been to invest more in filling some of those knowledge gaps. Yeah.
Yes, thank you. And it's a difficult time to be calling for more investment, but it's very important that we still do continue to. Also for you, Zavai, one last question is, what are your thoughts on targeting all women and girls with interventions versus stratifying by risk?
I think it's important that as we move forward, we sort of shift into sort of this risk stratified care, because not everyone needs the same kind of care. And I think the algorithm that we are offering is a good tool to help with that. And also, as I highlighted, one of our key findings is micronutrients on their own are not enough for some women who are underweight, undernourished, they require food support. And unfortunately, the current sort of the programs within the region are failing to do that in a good way. And hence, I'll still sort of push that we need to start shifting into sort of risk stratified care. And we are already doing that when it comes to early infancy, identifying infants at risk of poor growth and development. And I think the same principle applies in the other areas of our work. Thank you.
Thank you. Yes, that's a very good reminder, Zavai, that micronutrients are not enough. In undernourished populations, we really need to combine it with additional support that the women and adolescent girls need. Thank you. Okay, so I think we're nearly at our time. So there are some questions that haven't been answered. We will try and get back to you and answer them. We'll get some answers and post them. But want to thank everybody for asking so many interesting questions. And also a reminder that the reports will be translated into French, and so they will be sent. They will be available on the websites, and we will also share the slides and the recording from today. But just before we close, I'd like to hand it back to Zavai for a couple of closing remarks, and then that will be us done. Thank you very much. Over to you, Zavai.
Thank you, Emily, and thanks so much, colleagues, for joining. I hope you found this webinar and exchange helpful. And we encourage you, please read, share, amplify the reports, the tools. And I think in the links, we've shared links to some of those reports, but also we'll share with Emily and others other resources which can be made accessible to everyone. Good nutrition is the bedrock for well-being of women and child survival and development. And preconception period is crucial for improving maternal and child health and nutrition. And I think the task ahead is quite clear that one of the key shifts we need is bringing this focus around the preconception period and also identifying women early before pregnancy and providing them with the right kind of support based on nutritional risk. And I think with your help, we can make progress on this front. And I think in one of the slides in the earlier presentation, it was quite evident there are still some of the evidence gaps which are sort of precluding policy. But I think we should not wait for perfect evidence. I think we can learn from practice, and we can offer the best we can in terms of nutritional support and care for women who are most vulnerable and in need for this support. I think to make further progress on nutrition, we need to start early, and we need to ensure a full continuum from adolescent girls, women within preconception, pre-pregnancy, during the interpregnancy intervals, continuing all the way to pregnancy and beyond. And I think with your support, we can achieve all this. So thank you so much for joining, for your time, and let's stay connected and happy to support if any support is needed from both ENN and UNICEF. Thank you. Over to you, Emily.
Thank you, Zavai. Okay, thanks to everybody for joining. We will close now and enjoy the rest of your day. Thank you. Goodbye.